we are a little bit late with this session, but it's time to start. And I see that we are connected. So now we are going to dedicate some time to telemedicine. And as we are going to go from the bigger picture, from the global knowledge towards the telemedicine in Slovakia in particular, I am very pleased to introduce my colleague, Marelize Gorgens, senior health specialist from the World Bank, who has extensive experience in global health systems. She has worked in many countries. She has recently joined our World Bank Europe and Central Asia unit. And we are very pleased to have her with us today. Marelize, we would like to ask you to present us some insights and snippets of global experience. Thank you.
Thank you very much. It's my pleasure to do so. Can I just confirm that everyone can hear me?
Yes.
Excellent. So let me share with you what have we learned about telemedicine around the world. I think the first thing that we would all agree on is that telemedicine has risen precipitously throughout the world. And there are several reasons for this. If we look at the 5 key drivers of telemedicine adoption around the world, regardless of a country's economic level or the advancement of its digital health system, there are 5 main reasons why telemedicine is being adopted around the world. The first is the rise of chronic diseases, and chronic diseases, because of the continuous and ongoing follow-up that is needed, lends itself particularly well to telemedicine. Secondly, as we know, there is a healthcare professional, a health worker shortage around the world, be it in radiology, be it in specialists. We simply need more people who can provide healthcare. And as chronic diseases rise, that need for healthcare professionals who can look after people for a longer period of time is only going to increase. We also know that there have been several technological advancements that have made telemedicine more feasible. There's a demand for convenient access and simply the reality that we grow up in a digital world. Us in this room today and our children accept that digital by default is the norm in many areas of life. Why not also in healthcare? And as we can just look here at the estimated global telemedicine market size, you could see that it's increased 5-fold, or it's anticipated to increase 5-fold in billions of US dollars from 2024 to 2034. So as this rise in telemedicine is occurring, what are some of the challenges that countries have experienced? There are 2 types of challenges: regulatory and policy challenges, as well as implementation and financing challenges. Let me first discuss the regulatory and policy challenges. There's licensing variations in countries that make in-country and cross-border telemedicine particularly hard. Reimbursement policies are often not clarified, and health insurance agencies or health insurance schemes are unable to reimburse or unsure of the level with which to reimburse for remotely delivered healthcare. Data protection laws can make it difficult to deliver healthcare if not with a person in front of a physician, and there are liability concerns. In terms of implementation and financing challenges, the first one is that there is not a standard global definition of telemedicine. Some countries like Finland, for example, include wearables, a watch on our phone that may detect, a watch on our arm that may detect, rises in blood pressure, for example, as part of telemedicine, whereas other countries don't do that. There are inconsistent technology standards, platform-specific challenges. WhatsApp can only talk to WhatsApp. Facebook Messenger can only talk to Facebook Messenger and so on. There are reinsurance and reimbursement challenges. The quality of care standards have not always been set. There are issues with patient confidentiality and data security from the patient's perspective. Patients and healthcare providers aren't always familiar with how to use these technologies. And there's the challenge of the digital divide and accessibility. Often people who are least likely to be able to access healthcare in remote areas or older populations, if we think about the gray digital divide in rapidly aging societies, for example, those folks are also least likely to want to and be able to access telemedicine. So the service that's meant to improve accessibility is often the least accessible to the people who most need it. So what are some success stories and good practices that we've seen around the world? Let me share a few with you. The first is that we see innovative models and platforms arising, from AI-enhanced diagnostics to, as we can see in China, to mobile health applications that provide through-the-line communications between patients and providers, as we can see in Kenya and Brazil, to open and integrated telehealth platforms. And here, India really leads the way with eSanjeevani, which is the world's largest telemedicine platform that is at one stage, at over 1 million consultations a day. So India's open approach to telemedicine networks is unlike what we see in most countries. That is a platform-specific approach, right? So there's one platform for telemedicine visits, another for pharmacy visits, another for appointment booking. So in the India model, which is platform agnostic, any solution can technically talk to any other solution. Practically, someone in WhatsApp can talk to their doctor on a telemedicine visit if the doctor uses Zoom and the patient uses WhatsApp. Or you can use WhatsApp to make an appointment at your healthcare provider or check whether your pharmacy has the drugs that are needed. These are some of the innovations that we're seeing. Next, we're also seeing that more effective collaboration and partnerships are emerging. There's private-public partnerships, as we can see in the UAE and in Chile. We also see that there's more international cooperation in the EU context, which is very relevant for our discussion here today. There's cross-border telemedicine initiatives, as we also see in the Caribbean, as well as in the small Pacific Island countries. And then we see more and more that telemedicine forms a mechanism for teams from diverse fields to come together and not just develop better telemedicine solutions, but deliver better healthcare, as we can see in Japan and in Mexico. Most important, patient satisfaction improves. We see improvements in chronic disease management. We see improvements in reduced hospital visits through virtual follow-up and remote monitoring for patients. And we see higher patient satisfaction and higher health worker satisfaction. It is easier and more convenient to provide support to patients who need support on a longer term, as what is the case with chronic diseases. And then I think this is probably the most important part of this presentation, which is that we see, and there are several systematic reviews and meta-analyses that have now been done, that shows that telemedicine is not inferior care. For the longest time, telemedicine has been seen as a secondary form of healthcare, as not as good as in-person healthcare. And depending on what the health condition is that the person has, these two systematic reviews and meta-analyses have indeed shown that telemedicine can improve outcomes, as you can see in the bottom, which is the results from the 2023 meta-analyses, that compared to usual care, telemedicine can improve the quality of life, and there's no significant negative effects on depression, anxiety, fatigue, or self-care. So patients don't have less agency or don't feel like they're less able to have control of their own health condition because they've seen a doctor through a telemedicine or remote visit. It can also significantly improve physical functioning and social functioning, as these scores and the p-values clearly show. So let me just end by saying, as we look around the world and we look at these good practices, what are some of the lessons that's been learned, and what are some of the key messages moving forward? The key messages here is that in order for telemedicine to work, the infrastructure gaps, and by infrastructure, I also mean the digital literacy gaps, need to be addressed so that those folks who can benefit the most, who are in the most remote areas and the least likely to access healthcare, that telemedicine is specifically provided for them. We need to think about the regulatory alignment that is needed to align policies and regulations to ensure smooth adoption of telemedicine in the clinical workflow of how healthcare services get delivered. A patient might need to shift depending on whether their diabetes is stable or not. They may need to shift, for example, from a telemedicine remote patient monitoring modality to an inpatient modality and vice versa. We need to think about innovative financing. In Brazil, there is an NGO that delivers telemedicine services to remote rural communities, and they pay for those telemedicine visits through carbon credit. So they are a carbon credit issuing authority, and they use the savings from people not needing to travel to a health facility to offset those carbon credits. They actually sell those carbon credits, and it offsets the cost of the telemedicine service. So we need to think about truly innovative financing models like that. And we need to do away with this notion that telemedicine is second-tier care, only care for people who can't afford to go to a health facility in person. And then lastly, I would say that for countries that have not yet considered telemedicine, consider starting with provider-to-provider telemedicine, which already happens informally, which is often not reimbursed, but is yet an essential part of expanding the network of a team of healthcare providers who can best look after a person's health. So let me hand back to you, and thank you so much for the opportunity to share some of these global perspectives. Over.